The meeting will begin in about 4 minutes. The meeting will begin in about 3 minutes. The meeting will begin in about 2 minutes. All right, I have 2 o'clock now. So I want to welcome everyone to our meeting today, our update. Tracy, what do you have for us today?
I just want to thank everybody for joining us today. We have some questions that we will be discussing over the next few minutes. I do want to remind you all, if you have questions, please put those in the chat box as we walk through the meeting. Sean, do you want to give us some updates over the past 2 weeks, I guess?
Sure. I'll start by giving some case information updates and then some vaccination updates. As far as our case updates, I'll just give a summary by county. We've had a total of 1,715 cases in Adair, with 1,295 total cases in Casey, 1,407 total cases in Clinton, 660 total cases in Cumberland, 1,142 total cases in Greene, 1,817 total cases in Macquarie, 5,845 total cases in Pulaski, 1,765 total cases in Russell, 2,845 total cases in Taylor, 2,108 total cases in Wayne, for a district total of 20,599 total cases that we know of. Of course, we know there's a significant number of people who may have had COVID and never been tested that we don't know about, or maybe people who had it and were asymptomatic or so mildly symptomatic that they never knew they had it. We have currently district-wide 220 active cases. We have 41 hospitalized cases at present or as of last night. 179 on self-isolation. We've released 20,008 of our total cases, and we've experienced 371 deaths. Our death rate is our mortality rate is about 1.8%, which is about 1 in every 56 people that we know of that has had it, has passed from it. Our hospitalization rate is about 5.56% of our known cases, which is about 1 in 18. We've had almost 10% of our total population who have that we know have had it. And the growth rate has really slowed down. We were at our peak 7-day average incidence rate in early January, and that has gone down dramatically since January. We had our most single new cases in a day, December 30th, 301 new cases, and now we're averaging somewhere in the 20s to 30s. So a really good decline in total cases. So that's all good news. Also, the vaccination efforts are going good. The best I can tell, we are getting a little over 6,000 doses per week of vaccine into our district. I don't know the total number with absolute certainty because there's some of the vaccines being shipped directly from the federal government to local providers. And while there is a database that we can look in to see that, sometimes the vaccine gets subdivided, like maybe a large amount might be sent to a regional Walgreens, and the regional Walgreens might divvy it out to the some of the surrounding counties, and that information might not always get loaded into that database. So it could be there's a few places that have some vaccines that we don't know about, but pretty close to the 6,000 amount is getting into the district each week. So there are providers in each county. There's Moderna Vaccine and Johnson & Johnson vaccine available in our district now. So whichever vaccine you prefer, there's access to that. According to the governor, about 25% of Kentucky's adult population has now been vaccinated. So that's really good news and a really good start to this vaccination effort. For us, a couple of weeks ago, we were trying to limit our scheduling of the vaccine that we're receiving to 70 and older, or those others in group 1A and B. It became difficult for us to fill our appointment slots. So last week we expanded out to 60 and older, and we've had trouble filling those spots. So now we're going to expand out to the larger 1C group and see how that goes. And most of the other area providers have either expanded out into the larger 1C group or probably will before long. Each has to make their own decision about that based on their demand. I gather from having trouble filling the appointment slots that a lot of that market has been saturated. We are doing some specific outreach to different agencies in our 10 counties that deal with the elderly population to get some assistance doing outreach to the 60 and over, and we're going to try to continue to emphasize that group 60 and older by doing some additional outreach. And as we move through this, we'll probably do some more targeted work when we get more substantially into providing vaccine into the essential worker group and so forth. We may do some targeted efforts there, but so far it seems to be going along pretty good. Dr. Wayman or Stewart, anything to add to the vaccination efforts or the case information?
I think you covered it. Thank you.
All right.
All right. Thank you, Sean. I'm going to go ahead and start with the questions then.
Okay.
And I want to remind people, if they have questions, to please type those in the chat box. First question is for you, Dr. Wayman. What is the main difference between the new Johnson & Johnson vaccine and the Pfizer and Moderna?
Okay, so all of these three vaccines instruct the cells of our body to produce the spike protein, which is on the surface of the coronavirus. And once we produce that, then our immune system makes antibodies. However, the mechanism of doing that is different for Johnson & Johnson versus Moderna and Pfizer. Moderna and Pfizer use messenger RNA, and Johnson & Johnson uses a DNA, which is vectored in by a weakened virus. So, but the end result is we make more spike protein, and that's the way the immune system goes. Now, the other thing is you only need one dose of Johnson & Johnson, and you need 2 doses of the other 2.
Okay, thank you. Next question, I think you've already answered this, Sean, but it says approximately how much of the general population has received at least 1 dose of the vaccines in Kentucky?
Now, according to the governor and Dr. Stack, about 25% of our total adult population has had the vaccine so far. So that's good. I was looking at some vaccination efforts over time, and of course, our early efforts was skewed more toward younger. When I'm saying younger, 20 to 40, because we were emphasizing healthcare workers, first responders. After that first push, our vaccination efforts over the last several weeks have skewed much higher toward the 70 and older and 60 and older population. So, the vaccine is largely being utilized each week in the strategic way that public health is trying to roll it out. So, I know people are anxious to get the vaccine, and there's lots of providers now, and I hope no matter who you are, if you want one, you're able to find a dose. I know with our supply, we're still trying to target the 60 and older as much as we can. I remind everyone that the 60 and older represents 91% of our deaths and close to 75% of our hospitalizations. Once we saturate that target market, we will have made a tremendous public health impact on our path to herd immunity. And so as we're moving toward that herd immunity, we want to protect the most vulnerable populations first. And so far, we've largely done that. So I know it's not been without pain. As when I say pain, I mean, there's a lot of people that want the vaccine that have struggled to get it. And maybe now it's more available and less of a struggle. But over the last few weeks, it has been somewhat of a struggle as we've tried to target the healthcare workers and first responders, school staff, and then 60 and older.
Sean, you're fading out a little bit, so you may want to check your mic or turn it up a little bit.
Oh, I'm probably just sitting too far away from it.
Okay.
How much of that did you hear?
I heard all of it. You were just low. But let's talk about herd immunity for a few minutes. What does that look like for Kentucky and Lake Cumberland when we talk about herd immunity?
Well, Dr. Wayman's probably the most qualified to answer that. I can give you a layperson's definition, but.
And you probably have it right, but basically you need about 80% of people either being immunized or having had the disease to have what we call herd immunity. That means there are not enough susceptible people scattered around that can propagate the virus.
Yeah, so what we're seeing, we've had about 10% of our total population that we know has had the virus. And we've had, if our Lake Cumberland numbers align with the state numbers, about 25% of the population. So you're up to, of course, there's some overlap. Some people who had the virus has taken the vaccine too, but let's say roughly 35%. What we don't know is we don't know how many people may have had it and been asymptomatic or so mildly symptomatic they never got tested. There's different studies that suggest different numbers. But maybe the downturn in the cases, it's a combination of us getting closer to the herd immunity, a combination of the vaccinations happening, a combination of some people having had it recovered, a combination of people continuing to follow the guidance. And speaking of continuing to follow the guidance, it's still important to do that. I know the president and the governor have both said that, there should be enough vaccine by the end of May, maybe sooner, that everyone that wants a dose would have had the opportunity to get it. Uh, you know, it, as we're finishing this out, we don't want to give the virus a chance to spike back up. So, until the large amount of the population's had the vaccine, do continue to use good judgment about distancing and social distancing and masking and hand sanitation, general sanitation, and those things. We're really close, getting close. So let's don't let it take back off here at the end. We've wanted, as we've gone through this, the whole isolation and quarantine process, and now the vaccination process, we've really wanted to preserve as much life as we could and to avoid as much hospitalization as we could. And, we've done a pretty good job of that. It would be a shame here at the end to lose any life unnecessarily or to have any unnecessary hospitalizations. So, just for a few more weeks, please be cautious and get your vaccine as soon as you can.
Thank you, Sean.
One thing, Tracy, before we move on, and Dr. Wayman can clarify this if I'm wrong. They still don't know if you could potentially, even though you've been vaccinated and you may not get the disease or become sick from the disease. I think there's still the jury's not in on whether you could potentially carry that disease and shed that disease to others who have not been vaccinated. So that's the reason why we want to continue our social distancing and mask wearing. Am I correct on that, Dr. Wayman?
To some degree, you are. More and more data now suggests that once you've been vaccinated, you really don't have asymptomatic infections. However, since we don't know who's vaccinated and who isn't, certainly in public and in businesses, you should wear your masks. Now, the CDC has come out with some new guidelines, and that's one of the questions, so I will answer some of that on the next go around.
Okay.
In the chat, I guess it's Mr. Ford or one of the personnel at Russell County Board offered that if there's anything the school district can do to help with outreach, let them know. So we always appreciate Russell County School Board. It's one of our most proactive school boards in the district, regardless of if it's COVID. I mean, just in general, they're one of the more proactive school boards. So we always like to give them a plug because we really respect what they're doing there.
Okay. I'm going to go on to the next question. Okay. Dr. Wayman, it's for you. Can you break down the development process of not only the J&J, but the Pfizer and Moderna as well? Because we've heard that these companies use aborted fetuses in the early development. Is that true?
So the companies do not use aborted fetuses. That is not true. However, they do use cell lines that were established in the 1970s and 80s, which actually were derived from aborted fetuses. I just want people to know that aborted in medical terminology means either spontaneous abortion or elective abortion. And now no vaccine actually contains any cells. So the J&J vaccine, the virus has to be grown in cells, and the Moderna and Pfizer vaccines had to be tested in the cell lines in the very early stages, but they have not, otherwise they didn't have to use that at all.
Okay. Thank you, Dr. Wayman. Next question. Is the Moderna vaccine the only COVID vaccine the public health departments are administering?
Currently, it is the only vaccine we're administering, but we are hoping to get the Johnson & Johnson in the next few weeks.
I think what we found early on is that the public was demonstrating more confidence in the Moderna, and that's in the sense that was the most requested vaccine when people were reaching out to us. Now we're starting to see more people ask for the J&J or Johnson & Johnson vaccine. So, we will likely get some. If you've been following the governor's news briefs, Johnson & Johnson has pushed out all of its initial vaccine that it had in, and there's going to be a delay for a few weeks, if my memory is correct, before the next shipments start going out. But when we can get some, we're going to start getting some. The advantage of Johnson & Johnson is it's a one-dose vaccine, and it would be really helpful for certain groups to have a one-dose vaccine as we're trying to target certain difficult to reach populations and so forth. Having that one dose, will be advantageous. The bird in the hand concept. So.
Okay, thank you. Next question, and this is you, Dr. Wayman, again. I heard that the CDC has come out with updated guidelines pertaining to COVID and persons that are fully vaccinated. Can you explain?
Okay, so we are pretty confident that the vaccines work very well. And so therefore the CDC has said that you can gather indoors with fully vaccinated people without wearing a mask. You can also gather with one unvaccinated household without a mask, providing they're all healthy. You also do not have to quarantine if you've been fully vaccinated. And what that means is it's been at least 14 days after your second shot with the Moderna and Pfizer, or 14 days after the one shot of Johnson & Johnson. So you don't have to quarantine if you have been exposed. That's basically the changes. So that's why I was stating that it's a little different to what you were saying, Stuart. So yes, we should still protect ourselves from the general public, but within certain households, we can now relax a bit and see the grandparents.
And regardless of your political leanings, I think most of us want things to get back to normal, and quicker, better than later, sooner than later. And regardless of if you're, pro how the CDC has handled this or not, or if you're pro how the Kentucky governor's handled this or not, we're all anxious to get back to normal. And it is encouraging that the CDC is beginning to, have enough research and enough confidence in the research to start loosening things up. And the state is getting confident enough, they're starting to loose things up. Now, maybe the loosening up's not coming as quick as some people think, and maybe it's coming too quick according to other people, but it is good that we're moving toward normal. And Lord knows, hopefully by, early summer, midsummer, it'll be largely normal. So I've got high hopes. I hope people take this vaccine. If it's going to be available to everyone that wants it by May, man, I hope most people take it, because we all want normal.
Yeah, and on what Dr. Wayman said in the new guidance, to get together with your friends in your house, it's a great thing now to be able to do that, and be able to do that with some confidence then. But still, as long as you're out in the public, going shopping and going to school and to work and to church and things like that, that's where we need to continue to mask and social distance, at least for a little while.
Yeah. And Dr. Wayman, just before this meeting, Dr. Wayman and I was looking at the trend charts for several other countries. And in the United States right now, the trend of the new case rate trend is consistently going down week by week. But there are other countries in the world where that's not the case. There are places where it's gone down to, on a world level, it's gone down to a certain level and now kind of plateaued. And it's not going up, it's not going down, but it's kind of plateaued. And then there's certain countries, I think we looked at Italy and Brazil. We looked at several, but Italy and Brazil stood out because their case rates are going up. There could be a lot of reasons for that, but I just want to say we're not completely out of the woods yet. I mean, it's not the time to let our guard down. It's very hopeful. Kentucky, the United States is fortunate that we have enough resources as a country. We're going to be one of the first countries to get the vaccine out and available to everyone that wants it. Now, there'll be some other countries that'll be at the front too, but we're one of the first countries that'll have it to everyone that wants it. There's certainly going to be a lot of countries that's way behind us. So, let's be thankful that we're blessed as a nation. And when that opportunity is available for us to get the vaccine, let's get it. Let's take advantage of the blessings that we have and not give this thing a chance to kick back up. I'm fearful, like most public health folks, that there's still a significant number of people that's not had it, and they will get overconfident in the data that things are going down, and they'll just throw caution to the wind, and this will get a foothold again and start spiking back up. And no one wants that. No one wants that. So get the vaccine when you can get it. Use precautions until about May, June, when a lot of the stuff I think is going to really loosen up.
Yes, definitely.
We're about at the last question, by the way. So if there's anyone, we do have people watching live that if you're watching live, if you'll type in your YouTube chat box, if you've got a question, we'll try to answer it. Otherwise we're about to the end. So.
Okay. And we are at the end. This is the last question. Do we still have to get COVID shots each year from now on?
So we are pretty confident that these vaccines are working well and that the immunity we get from them will last quite a while. However, and currently they do cover all the strains, the different strains that are floating around the world. However, if these strains change more, and of course, the more disease you have, the more virus is spreading, the more likely you get mutations. And if we get one that isn't covered by the vaccine, then yes, we will need new vaccines.
Yeah.
But we will have to see how that goes.
Yeah. And Dr. Wayman, I haven't even talked to you about this, so this is a question just out of the blue. But with like the flu, we know every season the flu is going to mutate enough that there's going to need to be a new vaccine.
Right.
And the drug companies in the world that produce the flu vaccine, they're stood up to the point that they can keep a consistent flow of new updated vaccine each year coming into the market so that the public can get that. Now that these drug companies have been stood up and they've got the processes in place to develop the coronavirus vaccine, I mean, if the virus shifts enough to where the current vaccine becomes ineffective, I mean, how long will it take them to develop the new vaccine and get it produced? And will it be more like the flu vaccine, or that's still yet to be determined, or what's the?
It probably won't be like the flu vaccine because they are already doing studies on new vaccines where they've changed the genetic code of the actual vaccine to suit the strains that are floating around. Even though at this point in time, we don't really need them yet, but they've got the process going. And with the current way they're making vaccines, which is this mRNA or the DNA viral thing, they're much quicker to produce than the old fashioned grow in chicken egg, in eggs, et cetera, et cetera. And the other thing is with the flu vaccines, they have to wait till there's a flu in the southern hemisphere, and then they use those strains to make the vaccine. So everything's sort of, we wait, and then we run. Whereas hopefully we're doing surveillance on the COVID so that we can jump on things that are totally different.
So in other words, we have a substantial head start.
Yes.
As compared to where we were when this thing just emerged. When was it? Early
March for us.
For us, March, but just a few months before that for the world.
Yes.
So we're in a lot better place. So hopefully the answer is no, we won't need an annual vaccine. But if we do end up needing one, they can develop it much quicker than this first vaccine has been developed, or these first series of vaccine.
Yes.
Okay,
Because
well, that's good.
The technology is now established, so you don't have to study that. You just go. You just change the cartridge in the printer.
Okay, good. That's sometimes changing the cartridge in the printer is really challenging. I have to call the IT staff to get in there and take the thing apart. So if it maybe, but I guess the pharmaceutical worlds have their own tech people figuring this stuff out. I'm sure they do. They've got years of experience and research and education and are good at what they do.
I have no more questions. Are there questions in the box? In the
No,
chat box?
I don't see any questions in the chat box. I'm glad that the vaccine's becoming more available. I'm glad that the numbers are going down. The things that I would say is take the vaccine as soon as you can get it, as soon as you qualify. I mean, don't try to cut in front of someone else if they're ahead of you. But take it as soon as you can, as soon as you qualify and it's available to you, take it, and continue to use cautions, at least for the next few months while this vaccination effort really gets out to everyone.
Sean, one thing I wanted to touch on today, there's been some questions, at least through our Facebook, that of course the health department routinely operates lots of programs. We have several divisions, we have several programs that we operate, and some people have questioned, why haven't we operated those programs and those services at our capacity that we normally would. And I would say, and I'd like for you to chime in, that one, during a public health emergency, which COVID has been, this is the one of the main functions the health department was set up for years and years ago. The public health system was to deal with these contagious viruses. Now, it started back years ago with a cholera epidemic back in England and grew out of that. That's kind of how our public health system grew. So an infectious disease like cholera. So during the time of coronavirus, and also the years prior to coronavirus, our public health system has been, and I hate to use a negative word, but it's been gutted by reduced funding. So that's caused us not to be able to staff at levels that we used to be able to staff at. So we have had to pull in the majority of our staff into our coronavirus response and all the things that we're doing. Now, we are trying to get some of those things back to normal, but we're not totally there yet. We hope later on this year, sometime by summer, fall, that we'll be able to be there. But we're, we have the staff and the manpower to deal with, and we've even been short and had to go outside and hire people. The state has sent us some people for contact tracing, but we've been overwhelmed with this response, and our people are professional. They've done a great job doing that, but it's been so much that there's no way that we've been able to do our routine things on top of that.
Yeah, and the growth in new cases became so intense at one level at one time, and we basically stood up everyone in our organization to some degree, or to a very large degree. We stood them up in the sense that they were shifted from doing their regular duties to doing COVID duties. And there are certain things that we had to continue doing, but everything that we could suspend so that we could free up resources to deal with the coronavirus response, we had to suspend. And right now, as the case rates are going down, we're slowly standing down those employees and transferring them back into routine duties. And as Stuart said, we'll probably, assuming the cases keep going down, the vaccination uptake keeps being significant, we're hopeful by early next fiscal year, July, August, to be almost completely back to normal. I mean, that's certainly our hopes. We did over the last 10 years, with cuts and reductions in federal and state funding and increased expenses, we've lost about half of our public health workforce compared to where we were 10 years ago. And so that was a lot fewer resources, human resources, we had to call to bear when this pandemic hit. And we have been fortunate that the federal and state government has supplied us funds to hire additional staff to do contact tracing and case investigation. And they've done a great job. So I'm not saying this to be insulting in any way, but you can't replace the experience of public health workers who's done this job for years and years. And we lost a lot of our experience, a lot of our public health capacity over the years. And it's been a real challenge. So you can't just hire new people and use them to deal with the largest public health event in any of our lifetimes and keep our employees who are experienced and educated and trained in public health, have them doing our routine things. We have to take our most experienced and educated employees and use them as much as possible toward this significant public health event. And then we use the temporary staff that we've hired to supplement that. But anyway, long answer to say that, yes, it is right. We haven't been able to do everything that we routinely do, but we hope to get back to a much closer semblance of routine early next fiscal year, July, August. That's assuming people take the vaccine. We don't have an uptake. New cases continue to lower. We're hopeful to be back to that. And everybody wants that. I mean, there's nobody in the world any more tired of dealing with coronavirus than public health. We've been beat up by it and by the politicians and by the public, all we want for a lifetime. And I'm not saying, I mean, there's been a lot of people that's been appreciative of what we've done too, but it's not been without controversy. It's not been without challenge. And we're thankful to have been able to be here and to stand up and to respond to this, but it's certainly not been without challenge.
Okay, Dr. Wayman, do you have some thoughts before we go off?
No, I just advise everybody to get vaccinated. That's the only way to beat this. Or to get sick, I suppose, but we don't want to get sick.
True. Sean, if there's no more questions, I have none either.
No more questions.
Okay, so just remind everyone to, if you're out and about, please wear that mask. And then there are lots of places across our communities that are providing the vaccines now, health department included. So make sure that you check out our website because all that information is updated nightly, right, Sean?
Yeah, it's in our daily brief. As soon as I find out a new site has been added, I try to include it in the contact information. So we post our daily brief on our social media page, but if you can go to our website and just click that main COVID banner, it takes you directly to our news brief. The news brief, the first half is current case information and the bottom half is all the vaccine sites. So just scroll down there, you'll see a lot of places that's providing vaccine.
All right, so people get vaccinated and we will be back in 2 weeks, which I think is March the 24th, to share additional updates.
All right. Thank you for joining us.
Thank you.